Hey everyone, this is Dan Kamenstein. I hope you all had a great Thanksgiving break. This is a review of the answers to the cardiac ultrasound quiz. So as you remember, we had Mr. Brokestone who came in with some chest pain. And during the ultrasound lab, we talked about some of the differential diagnoses that you would be worried about with his presentation. So the quiz questions really asked you to use the ultrasound images you obtained to think anatomically about how you would start to evaluate some of the differential diagnoses that you came up with during class. So question 1 really was just to upload your images. And then question 2 asked you to think about what you would do in a patient with pulmonary hypertension. So Mr. Brokestone has been smoking his whole life. That is a risk factor for pulmonary hypertension. And you were to take one of your images and put arrows where you thought you would see chamber dilation if in someone who had pulmonary hypertension. And we talked about in class, the right side of the heart is what supplies blood to the lungs. And so if you had high right heart pressures because of high pressures in the pulmonary arteries, you would expect to see dilation of the right-sided chambers. So this is a subxiphoid view of the heart, and the arrows are pointing to the right atrium and the right ventricle here. So that was the image we wanted to use, was the subxiphoid image. That was the only image where you could see both the right ventricle and right atrium. Now, your image doesn't have to be perfect. We just wanted you to recognize that when you're in a subxiphoid view, the right side of the heart is the side that is closer to the liver. And here in this image, you can see liver here. So that was question 2. Question 3 then gives you a physical diagnosis finding. And this is a heart murmur. And we wanted you to recognize that that is the murmur of aortic regurgitation. So that's an aortic murmur. And in this question, you were asked to point to the valve that you would expect to be abnormal with this description of a murmur. So here you can see we have a parasternal long axis image, and the arrows pointing here to the aortic valve. And this was the only image that you had where you would be able to see the aortic valve well. Now, when we get into more advanced ultrasound, we'll discuss the use of Doppler. And so this is an image, a Doppler image of aortic regurgitation. And you can see here we're looking at the aortic valve, and this little blue jet that's coming back through the aortic valve in a parasternal long axis image is actually the regurgitation jet. And so we will explore that in second year a little bit more about investigating and looking at the valvular pathology that you hear when you auscultate someone's chest. The concerning thing about aortic regurgitation is that if it develops acutely, it can be a sign of aortic dissection. And that was another differential we talked about. So in question 4, you were asked to think about a patient with aortic dissection, and if he developed a large pericardial effusion, which can happen quite commonly if the aortic dissection goes back into the pericardium. And what we wanted you to do here was to take one of your remaining long axis images. So remember, in the images you uploaded, you should have a long axis image of the heart, which we used already to look at the aortic valve, and a long axis image of the IVC. And so you were to take your remaining long axis image, put a star in the area of the heart that would collapse first in a pericardial effusion, and then also an arrow to indicate the direction of blood flow that goes into this chamber. So here we have a long axis image of the IVC. Here we can see an arrow pointing towards the heart. So here's the liver here. We remember the blood flows from the legs towards the heart here. And we have a star roughly in the area of where we would expect to see the right atrium. Now in this image, you can't see the right atrium very clearly, and that's fine. You didn't need to necessarily have a perfect image of the right atrium. I just wanted you to put a star in the area where to expect to see the right atrium, and just recognize that blood flows back from the IVC towards the right atrium there. Now your final question was to take the last image. So that was the short axis of the IVC, where you should be able to see the IVC and some of the hepatic veins, and to put arrows in the 2 different regions where you might expect to see signs of increased pressure if you had a large pericardial effusion. And so if a large pericardial effusion causes the right atrium to collapse, it will then cause the IVC to dilate. And if the IVC dilates, then the hepatic veins can also dilate. And so in this case, we see an arrow pointing to the IVC as well as an arrow pointing to the hepatic veins there. So that was the answers to the 5 questions that you had. I hope you guys enjoyed this lab, and we look forward to seeing you next time.